Hi, I'm Connie Fox with Freedom from Metals, and I'm here to answer another question for someone named Michelle. This is a different Michelle. I think the last question was from Michelle as well, but she asks, what test do you recommend to determine heavy metal toxicity? I have done a hair mineral analysis, but it didn't find anything. Are there any other tests that are better? So I hope this video really clears this frequently misunderstood topic that I just hear of regularly. So that's why I wanted to answer this rather quickly. So I'm going to talk today about three different tests: a blood test, a provoked urine test, and the toxic metals and full mineral hair analysis. There are a few other tests that test for metal levels, like there's a breath test, there's a stool test, there's a fingernail test. Um, those are just really never, ever done. They're not really reliable at all or recognized in the medical community. And there is an Allego scan, which is a test I'm actually quite impressed with, but I'll save that for a different video. That's also very rarely used, but worth discussing more in another video. So I'll be talking about first, let me just start off with a blood test. I still see this every single week in my practice where a patient goes to see their doctor or health practitioner who works with heavy metal toxicity. And the first thing that they do is order a blood test. And it comes back either very low or no, quote, normal range levels for mercury or another metal. And the patient is quite surprised or even disappointed oftentimes because in many cases, in most cases, by the time they get to that point, they've already been seeing many doctors and not getting any proper diagnosis, not finding out what's really wrong with them. And then they finally hear about mercury or heavy metal toxicity and the symptoms, and it completely sounds like their case. And so they go see a doctor to get tested for it. They suspect they're heavy metal toxic. They want to go see a doctor to get tested for it to confirm. And that doctor or practitioner will immediately order a blood test. This is like maddening for me still. In 2025, this still happens all the time. So a blood test is not an accurate test for metals and especially mercury, simply because mercury leaves the bloodstream very quickly upon exposure, actually immediately upon exposure. And I think, don't quote me on this, but within hours, 90+% of it is out of the bloodstream. Within 72 hours, don't quote me on that. I haven't read that in some years, but it's out of the bloodstream quite quickly. So unless someone's been like acutely poisoned, let's say had an accident working in a coal burning plant or a hazardous waste material plant where they work, or something of that nature where they suddenly acutely got poisoned, then perhaps a blood test would be called for. But someone that's gotten slowly mercury poisoned or lead or aluminum poisoned, slowly, that's usually the case anyway, over the years through the various sources of exposure, which I won't get into in this video, but I will another video. And that has to be limited in how much I say, actually. But another topic of discussion for another day. But someone that's been slowly getting poisoned with mercury from their amalgam fillings or other ways, it's not going to show up in the blood. That's only if you've been very recently exposed to mercury. I do actually see patients that have a certain level of elevated mercury in their blood test, and it's, let's say 10 or 15. It should be under 5. And just so you know, over the years, that number has gotten higher. Years ago, it used to be under 3 was normal. Now 5 and under is normal. It keeps getting higher and higher because more and more people are getting more mercury and heavy metal toxic. But it's always because they're a seafood eater. We can tell in their bloodstream, if they get a blood test, that their blood will be elevated, their mercury level will be elevated for a few days to a week at the most or so. And if they're a frequent seafood eater, it will be elevated, but not that much. And the doctor or practitioner says, okay, you might be slightly high if that's the case, if they're a frequent seafood eater. But most of the time it comes back completely normal and normal range. And the doctor said, you're fine. You're not heavy metal toxic. You're not mercury toxic. And the patient is actually oftentimes very distraught and hopeless at that point, because that was oftentimes, that's their last hope. Wow, to find out what's wrong with me, what's causing all of these crazy symptoms and making me so sick. And no doctor, no practitioner, no one can find out what's wrong with me. And so it's just, this is still not taught in medical schools. And I've had several even medical doctors tell me this. I'm not a medical doctor. But I'm not trying to, poo-poo medical doctors. I often talk about the medical doctor, Dr. Dietrich Klinghardt, who saved my life, and I feel recovered because of him. So I'm definitely not against medical doctors. But this topic is really just not taught in medical or dental school still. And they're still taught to do a blood test. So just so you know, a blood test is not an accurate test for toxic metals, including mercury. So let's get that out of the way. All right, so now getting into the hair analysis test. This is a very common misunderstanding. So the same story goes where a patient finally hears about the symptoms of heavy metal toxicity. They've been searching. This is not every case, of course, but oftentimes people are searching for years to find out what's wrong with them, a long time with no answers. And they finally somehow get some information about the common symptoms of heavy metal toxicity. And a bell goes off and it sounds like, oh my gosh, this is me. And so then they hear about getting a toxic metals hair test to test for their metal levels, or toxic metal levels like cadmium, arsenic, aluminum, mercury, lead, and so forth. Gadolinium, all metals, toxic metals, including minerals, if the doctor or practitioner also orders a full mineral hair analysis. Sometimes they don't, and I want to talk about that as well, because that's very important to also get those tested for an accurate reading. But oftentimes, and I would say at least 90% of my clients will test no or low mercury or other heavy metal levels in their hair test, and they can be severely mercury or heavy metal toxic. A hair test shows what you are excreting, okay? What the metals that you're excreting via the hair. Now, our hair grows about a half an inch a month on average, from what they say. So if you collect the hair and send it off to the lab, it's going to test the first inch to the first inch and a half of hair. So that's the 2 to 3 that's 2 to 3 months of hair growth. So it's going to let you know what you were excreting approximately 2 months prior to the hair removal collection time. So it lets you know, again, it lets you know what you're excreting via the hair, not what's in the cells, not what's in the tissue. So the big issue is with metals, and especially mercury, because it gets stored inside the cells immediately upon exposure. We get exposed to it, it starts storing intracellularly all over, including the brain cells, and stays stuck, stored, trapped there, literally, virtually forever, especially the brain cells. It's very hard to get metals out of the cells, especially the brain and especially mercury. And that's why it takes work. It takes giving the body what it needs, the substances and the support that it needs to efficiently remove the mercury and other metals. And of course, at a pace you can comfortably handle. That's always key. At a pace you can comfortably handle. That's my motto statement in my practice. So, so the hair test can sometimes show, quote, what they say, false, low, or no levels of metals. And then my client is distraught. Oh my gosh, I thought I was a classic symptom of some of this mercury poisoned or lead or what have you. And I have no, it shows I have none. So you need the proper training for how to read a hair analysis. You don't just go by the number. You have to know how to compare the toxic metal levels with the mineral levels. So it's extraordinarily important to also do a full mineral hair analysis. It tests for approximately 18 different minerals, depending on which lab you use, 16 to 19, 20 different mineral levels. This really is maddening to me too, because I see this very frequently where they will test the toxic metal levels and some mineral levels, but not all of them. And we can't get an accurate reading of what metal levels are in the cells and the tissue without seeing all the mineral levels. So this was actually kind of taught by Dr. Andy Cutler, Cutler, a PhD, kind of like a heavy metal guru. I actually consulted with him years ago when I was ill. He authored a few books for practitioners and lay people, but he really coined the term mineral derangement and really taught about how to accurately read a hair mineral analysis test for one's cellular mineral levels. That's a wonderful thing to know. What are our mineral levels at on a cellular level? A blood test for these nutrients is not a good test. It just shows what's in our blood at that moment that we did a blood draw. What are we actually metabolizing? What are we absorbing? What are we able to utilize? So we want to know the cellular level. And so a hair mineral analysis test is good for letting us know what our mineral levels are on a cellular level. And when we know how to compare the mineral levels to the toxic metal levels, we can get an accurate reading. But a lot of doctors will kind of poo-poo a hair test because they haven't had that training and they don't know that. So they sometimes will recommend or frequently recommend a different test, the Provoked urine test, which I'm about to speak about next. So just to let you know, I try to explain that I can clearly see from someone's mineral levels with their toxic metal levels. One, if they're an efficient excreter, and a Dr. Boyd Haley, a dentist, a huge advocate against amalgam fillings, he kind of speaks of that regularly. We've got to become good excreters. He says that we've got to become good excreters. And that's the whole goal of a heavy metal detox program, is we want to make you a good excreter, because metals do not leave the cells very easily at all. That's the problem. That's why it can be challenging to deal with this condition. So the goal is to give the body what it needs at a pace that you can comfortably handle to more efficiently be able to remove the metals ongoing week after week after week after week. So the goal is to become a good excreter. And there's certain substances and things that we need to do and support the body to enable it to do that more effectively. That's what a heavy metal detox program is, or that's at least part of it. There's other parts too. There's repairing the cellular damage and eradicating the pathogens and rebuilding the immune system and restoring the intestinal mucosal layer that gets damaged, and a lot of other conditions that are frequently caused by heavy metal toxicity. But just to let you know, you need to know how to compare whoever you get to order that hair test. Don't just go by the number. You have to know how to compare the mineral levels to the metal levels. And in a nutshell, the mineral derangement is where we have, quote, scattered minerals. We have a lot of high mineral levels and lows, and in between, some are off the chart high, some really low. They're, quote, scattered. And when we have significant mineral deficiencies and significant mineral ratio deficiencies, which is typical for those that are heavy metal toxic. I don't think I've ever had any client at the beginning of my program ever not have significant mineral deficiencies. Heavy metal toxicity causes mineral deficiencies and also all nutrient deficiencies. Typically, we get leaky gut and impaired assimilation. We can't absorb nutrients as a result efficiently. We get microbes. They're eating half our nutrients. Metals and mercury bind to all minerals like a magnet, stealing it from the cells. So when like a metal particle is bound to a mineral particle, the cell cannot absorb it and utilize it. So those are just 3 reasons only, not to mention our organs and glands get very sluggish. Our metabolism is not functioning well when it's poisoned. So when we have depleted mineral levels, we are not good excretors. We are not capable of excreting metals efficiently if we do not have the mineral levels the cells need. That's just one substance that's critically important. It's integral. The cells need minerals on a cellular level to be capable of efficiently removing metals and mercury. We need a lot more than just minerals alone, but that's just one. So if our mineral levels are depleted, then I know when I see that mercury level, I know this person has a certain amount. It could be significant or even even way above that, depending on the test, of course, in the case. But I can tell, and anyone that just knows the basics of how to read a hair test. So it's not like it's rocket science. It's really not. But if you know how to compare the mineral levels to the toxic metal levels, you can, really see, okay, they're testing a little mercury coming out, but they're much more, they're significantly mercury toxic without a doubt, based on the level of exposure, on their health history, based on their specific symptoms, based on their mineral levels, and really a lot of other information that one gathers, or I gather during a full evaluation with a client. So you can get an accurate reading with a hair test. You just need to know how to compare the mineral levels with the metal levels. And it also lets you know how well you're excreting metals. Is this person a good excreter or not? I can tell in the very beginning, about how much time it's going to take to get this client to a point where they're able to excrete the metals more efficiently. And then they're going to start seeing their metal levels get higher and higher and higher in a hair test, because we want to, we track, or I track my clients' progress with a hair test. So the metal levels, as my client becomes a better excreter, which is the goal, of course, removing the metals more efficiently, the metal levels are going to get higher and higher in the hair test. And that's actually a beautiful thing to see, because we know that what we're doing is working and the body's functioning better and it's able to handle removing the metals more effectively. And that is the goal. And of course, doing it at a pace your body can comfortably handle. That is so not understood with so many practitioners out there. They're just like, have the no pain, no gain attitude. They just go like, all right, let's do this. Let's take this. Let's start doing this. And then clients can run into some really big trouble with exacerbation of symptoms, excessive cellular damage that's caused by removing the metals too much too quickly. We can go through sheer torture with the exacerbation of symptoms. And I'm going to try not to get off onto a tangent, because what I went through in my story, I can easily get off on a tangent with that. And I do talk more about that in the My Story video. But yes, if we remove metals prematurely before we properly prepare the body, and it's able to handle the efficient removal of the metals, and it can channel through and out efficiently, and the organs and glands are strong enough to handle filtering and neutralizing the excreted metals. And we protected the cells well enough, and the gut lining enough, and the brain cells and nerve cells enough, to handle that process well. If that's not done, then exacerbation of symptoms occur, and it can get very severe, where that person can be severely suicidal, and great suffering, mentally, anxiety, depression, phobias, obsessive compulsive thinking, no peace in their nervous system, pain everywhere, severe brain fog, cognitive function extremely impaired, severe exhaustion and fatigue, insomnia, where it's beyond maddening. Those are just a few of the symptoms. So it can get really bad if one mobilizes metals too much too quickly, or prematurely before they properly prepared their body. So I will leave it at that with the hair test. It lets us also know kind of how metabolism is. It gives us some great information, and it's a quite, affordable test. So I'm a big fan of the toxic metals and full mineral hair analysis. So I just want to make sure to point that out. If you ever order one, I mean, you can order one through me on my website. I'd be happy to send you one, but wherever you order one, make sure to always request that you also get a full mineral hair analysis, because if you just get the toxic metal levels and a few minerals tested, you're not going to be able to compare the minerals to the metals. You're not going to be able to get an accurate assessment or accurate reading with that. So that's just kind of the basics there of a hair analysis test. And now I'm going to talk about the Provoked urine test. So the Provoked urine test. How do I even begin here? So sometimes I have to be very cautious about what I say because this is a taboo subject. At least the last 5 years, it's been a taboo subject, so I have to be careful not to mention too much sometimes. So, a provoked urine test, it was created, from my understanding, it was created and made for someone that takes a specific chelator that's given or that was given intravenously. They do have it available orally, but it's like never given orally. It was made, this test, from my understanding, was made and created for a specific chelator, a substance used, a synthetic drug used intravenously that's going to pull out a bunch of metals that's stored intracellularly and dump it. And then it's going to travel through the body to exit, mainly through the urine and stool. And then you do usually a 6 or 24-hour urine collection. I mean, the doctor can order whatever they want to order. I've seen all sorts of different ways of going where they go about doing it, but typically in most cases it's a 6-hour urine test, sometimes a 24-hour urine test. With Dr. Klinghardt, I always did a 6-hour urine collection. That's the most common. I think that was the original way it was recommended. But so basically, it's a provoked. The provoking agent is a chelator. I can't say the name here on the video because I'm afraid it will be disapproved to stay on the internet. It's actually had so many thousands of negative reports that I can't even write an article about it on my website, for example, or it gets squashed, deleted. Anyway, it's a chelator that's typically given intravenously, and then you do a 6-hour urine collection in most cases. So that urine test was made for that chelator. So now, since that chelator is not often used anymore, it's been taken on and off the market, I mean, more than once from my understanding. So has the other commonly recommended chelator that's given orally, that's still quite common. That's been taken on and off the market because they get so many thousands of reports of severe damage to human health as a result of using it. So if the practitioner or doctor that recommends it really doesn't have a good, thorough, deep understanding of how to recommend it, especially for those that are more moderately to severely toxic, does not get the same dosage, it's not the same case as someone that's mildly toxic, and that's often just not understood because this is not taught in schools today, in any school that I know of, medical school or health school, nutrition school at all whatsoever in this country, still to this day. So the urine test is now, provoked urine test is now recommended, typically the test of choice for doctors because it's more easy to read. And so they give it more clout, so to speak, than like a hair test. So they will typically have their patient take an oral chelator which can be used, or even chlorella, or even ALA, or even a detox smoothie, whatever. I mean, you could take anything, any provoking agent, and do a urine collection. And many times they'll even have them do a urine test without even taking a provoking agent. And you're not going to see many or any metals show up in your urine because it's stuck in your cells. You need to take a provoking agent, a substance that's going to help pull it out from inside the cells. And it's going to be excreted, mainly through the urine and stool. There's something I want to clear up with this, and I have a lot of clients that get these provoked urine tests using the commonly recommended chelator that are in pill form. So I don't want to call it, I don't want to name it here in the video, but let's say the doctor has them take 1 or 3 pills, let's say 500 milligrams 3 times in one day, and then let's just say 6 or 24-hour urine collection, or 1,500 milligrams all at one time in one day. That's another common dosage, and then do a urine collection. Or maybe take it 3 times a day, a lower dose 3 times a day, depends, on whatever they recommend. And then you do that for 3 days and then do a urine collection. So you can get a lot of variables there based on what the doctor or practitioner is going to recommend. And yes, that person will have more elevated levels of metals come out in their urine, of course, presuming they are metal toxic. But one thing to just know, that if you took that oral chelator and did a 6-hour urine collection, and then you did the intravenous chelator that test was actually created for, you are going to get a much, much, much higher metal level in your urine than if you took even a high dose of the oral chelator that's commonly given. So some people will say, yes, my levels are elevated. That's not good. I know that I'm heavy metal toxic, and I know that I need to get on a good detox program. But they don't realize just by this test that they are far more toxic than what that's showing. If they showed that elevated level with just, let's just say 1,500 milligrams, of the oral chelator, and believe me, if they took that intravenous chelator that the test was made for, it would be much, much higher level. So it's just something to understand and just something to know. A lot of people don't quite get that. So those are really the 2 main tests that are typically given today. Is a provoked urine test. If you don't take a provoking agent with it, it's really a waste of money, in my opinion. Sometimes doctors will do that. They'll have you take a urine test that's not provoked, and then a provoked urine test, so they can show you that the provoking agent makes a difference. It works. It works at helping you remove the metals, because you can see the difference in the metal level. And so if they appreciate seeing that, then that's fine, of course. But just know, without a provoking agent, and I've seen some, they give them chlorella for a few days or one day, or a heavy metal detox tincture, nutraceutical or something, then, they don't really see many metals in their urine. And then, so their doctor mistakenly thinks they're not very toxic, and the patient doesn't think they're very toxic when they could be very toxic. So sorry to make that a little complicated. So the provoked urine test, I typically don't recommend, because it's dangerous if you're going to be using either of the chelator. They're dangerous drugs to use because they're very strong, they're harsh, they're toxic in and of themselves. And for more mild toxic cases, it can be non-problematic and work fine. One that's more moderately to severely toxic, it can be more dangerous. It can be much more dangerous the more toxic one is, to take either of those chelators. So keep that in mind. So that's why I'm not a big fan of the provoked urine test, because you need to take the intravenous chelator that it was intended for. If you're not going to use that, then the next best thing, so to speak, would be the other chelator in oral form. Really need to understand how that's not going to give you the same level, the same reading, so you really know how to differentiate that. But even that chelator can be a very dangerous for those that are more moderately to severely toxic. For example, Dr. Klinghardt, the man who I am everly grateful for, who's the top doctor in the world for this condition and all of the other many conditions that heavy metal toxicity causes, or I will say commonly causes, because I'm not a medical doctor. I can't treat, diagnose, or cure. But he sometimes does recommend both of those chelators. However, the very first consultation I had with him, he told me, do not ever touch that one intravenous chelator that I had been taking upon the advice of many doctors and getting worse and worse and worse, or the oral chelator that I had been recommended to take. And I actually wrote an article about my first time of taking 100 milligram cap of that commonly recommended chelator for metal toxicity. It's quite a dramatic story. It's a horrific story. Within less than 30 minutes, I went into like convulsions, like seizures. I almost died. I'm sure of that. It was a horrific experience. And that was considered a low dose. Yes, 100 milligrams was considered a low dose. The average dose was recommended per dose, and really more than one dose per day was typically prescribed then. The average dose was 500 milligram doses and even more than one a day. So I took a 100 milligram and almost died and had a horrific experience. But Dr. Klinghardt knew, and he is definitely a big advocate on chlorella as well. What a wonderful binder, heavy metal binder chlorella is. It's also very nutritional. And sometimes I recommend it as well at the right time for the right client. That's very critically important. But Dr. Klinghardt, on the first consult, he said, don't ever touch either one of those chelators. Don't ever touch chelator ever, chlorella ever again. I never did. And I fully detoxified and fully recovered because of Dr. Klinghardt. So it's not always a one-size-fits-all remedy for everybody. And so just keep that in mind, please, because that's often, there's so many people hear about someone doing well with that or did well with this, or that doctor recommends this, and they tried it and they got severely debilitated or sick or ended up in a mental ward for a month, or tried to kill themselves literally, or just went through severe suffering and torture. Taking some of these things that they hear about that worked well for others. So just know that Dr. Klinghardt does sometimes recommend those chelators and chlorella. But for me, he knew that that was not a good option for me and never was going to be a good option for me. I never took it and I fully recovered and fully detoxed. So please keep that in mind. It really is, heavy metal detox is a case by case. It needs to be, I'm not allowed to use the word treated, so I will say it just needs to be dealt with case by case basis. It's not the same one size fits all remedy for everybody. And I hear a lot of people where they, go on chat groups or this or that, and they take this or that worked for somebody else, and it put them bedridden, or they almost died, or it's just, horrible. So just be cautious with that. Don't just think, that if it's good for one person or one practitioner recommends it here or there, they might not recommend that for you. Or maybe they would, but 4 months down the road, so the timing is also very important, and also the dosage. So I guess that's it for now. So I always get off on a tangent on other topics of discussion. So, but I just wanted to get into this a little more in depth so you can really kind of understand a few of these other things that are really important things to know. Very important. It can actually really save you some unnecessary suffering and lost time and money. So it's important to address these things for those that don't have, the understanding of this, as I did not either when I was sick. So thank you for listening, and I really welcome your questions. I'm here to answer your questions. I'm here to help those of you who are struggling with heavy metal toxicity, or suspect that you're heavy metal toxic, or have a loved one that's heavy metal toxic. the right knowledge and information is very hard to get out there because it's still not taught in medical schools in this country. That's why I'm here. So feel free to ask any questions that you have in the comments below. And I'd appreciate you to like and subscribe the video as well and support the channel. I just started. And I will be giving my next video very shortly. Michelle actually had 4 questions. So I'll be answering her next one, next video very soon. All right. Thanks very much for listening. Bye-bye.